right now, where it's minus 50 degrees in many of the cities, the hunting reaction is basically the foundation of frostbite. And when you put an extremity in cold water or any cold temperature, initially you get vasoconstriction. Then the neurotransmission stops. So the cold actually stops the ability of the nerve endings to transmit signals, and then you get a vasodilation. And you get a cyclical vasoconstriction and vasodilation, which actually adds to the perfusion of oxygen into the tissue. This is why when you're in cold weather, you don't get frostbite right away. It takes about 10 to 20 minutes before you're completely frostbitten, because the hunting reaction protects you with this cyclical vasoconstriction and vasodilation that we have here. The reason this is important is because the hunting reaction is one of the foundations of why cryotherapy on the skin works, because by simply cooling the skin, it's a quick trick to actually getting more blood flow into the skin. I published an article in 2011 for doing office-based surgery using the hunting reaction, where essentially we showed that if you cooled the skin before the injections, you didn't have to use as much sedation because you wouldn't feel the needle sticks, taking advantage of this without any increase in skin necrosis. The second reason that cryotherapy works so well is because of something called the Bohr Effect, and I'm going to take you back to your medical school physiology. But anytime you have CO2, you're actually in this reaction adding to the acidity of the tissue, so you're increasing bicarbonate. And if you remember those Bohr curves in medical school, the higher the acidity, the lower the affinity of oxygen for hemoglobin. So in an acidic environment, hemoglobin releases oxygen, and the Bohr effect is really foundational to acid-base chemistry for human physiology. So how has CO2 and cryotherapy been impacted in dermatology? Well, in 1930, actually, the very first CO2 gun was developed right here in Paris by Lartat, Jacob, and Salant. And this was the device that they actually launched right here in Paris in 1930. The problem with this machine, as you can see in their initial drawings, was they controlled the concentration of the CO2 by the nozzle size. And so it was very difficult to actually know when you were creating therapy and when you were creating ablation. So many people actually got burned. In 1940, Harry Kiel published the slush method for acne treatment. Now, for any of you that know L'Oreal, La Roche-Posay, the slush method was basically taking frozen dry ice, mixing it with acetone, and then applying it to the skin to try to sterilize the skin for acne. The initial publications on using cryo-CO2 were published in the 1930s and 1940s, and in fact, the same slush method in 1950 was published as a significant treatment for rosacea. So the same process that we used the CO2 in the cryotherapy to kill bacteria for acne was published in the 40s and early 50s as a way to add blood flow for patients with rosacea. So the history of this is very long. What makes it interesting is in the United States, there's actually still a CPT, a billing code for doing slush therapy. And in fact, several dermatology companies still make a lot of money selling cheap dry ice to dermatologists so that pimple popping doctors can basically treat that disease. So, a couple of facts. One is that when you apply, when you apply CO2 cryotherapy to tissue, you suppress sebocytes. So the sebaceous glands get suppressed. This has been well established. The second thing that we know about the application of cold cryotherapy, CO2 cryotherapy to the skin, is that it actually has two effects. It stimulates the MMP and TGF-beta-1 in dermal fibroblasts, so there's a effect where you're actually stimulating dermal collagen production. At the same time, you're suppressing T cell activity in the cells. And the reason this is important is because of data showing that CO2 cryotherapy is very effective for diseases like keloids. So this was a split study looking at keloid therapy with a device called the CryoPen, and you can see significant reduction in keloids using this technology. Back to the Bohr effect, there was always a question in dermatology whether the CO2 effect was topical. And there's a critical paper by Seidel and Moy in 2015 which actually finally proved what people had suspected since the 1940s, which is if you topically apply carbon dioxide to the skin, in fact, you increase the oxygen tension in the tissue. So the skin actually absorbs the CO2, you get the Bohr effect, and you get increased release of oxygen in the tissue. So this critical paper in 2015 really set up what we're going to be presenting today with the design of the frozen sea. A couple of things. It is not a Zimmer system. Zimmer is at minus 25, and it does not use CO2. The critical foundation of cryotherapy is that you must apply the temperature close to minus 70. So you cannot use cryolyzed air to get the same effect. You get the neurotransmitter effect, you get the hunting reaction, but you don't get the Bohr effect when you use just cold air. So a lot of people ask us this question. The second question is really going back to that original design by Lortage, Jacob, and Servant here in Paris, which is how do you control the energy, right? There's a very fine line between therapy and ablation. Therapy is good, you keep the skin cold, you go from therapeutic cold to frostbite and ablation. Now, if you're trying to burn a lesion on the skin, that's good, but for a cosmetic therapy, we don't want to do that. So you have to have some mechanism for the system to actually terminate when you hit a critical temperature. And then the third thing is consumables. In many of the designs that are on the market today, unfortunately, they're using gas cylinders, and you have a very high consumable cost. The other problem with gas cylinders on these handheld systems, unfortunately, is low pressure. We know from the 2015 paper by Dr. Seidel and Dr. Moy that the pressure of CO2 onto the tissue actually facilitates the Bohr effect. So this is the frozen sea, which was designed with all of these ideas in mind. And essentially, instead of using heat to stimulate dermal collagen stimulation and other factors, we're using cryo. The machine is very beautifully designed because essentially what you have is you have a thermoregulation system that shuts the machine off when you hit the critical skin temperature. So it makes cryotherapy almost very, very simple because you go over the skin, and when it hits the critical temperature, the machine automatically shuts off. And this is actually the system. This shows you gas pressure, this shows you the skin temperature, and then when you hit that critical 5-degree point, which is where you want to be, the machine automatically shuts off. Here's a video. Wonderful sound effects here. But essentially the way that the therapy works is you protect the eyes. We put a glycerin gel on the skin, and the glycerin gel's purpose is to actually try to create an even plane for the cold. So they're applying the glycerin gel right now. Set your treatment time, so usually it's 3 to 5 minutes, depending on it. You have the nozzle, and you have the high pressurized CO2 that's coming out at minus 70 degrees centigrade, and then off you go. Aim the beam, and go. And you do it to the terminal temperature, and then the machine shuts off in that spot, so you do sections of the face. For us, the treatment can be done in under 15 minutes. You get the idea. Diseases in dermatology that can be treated with this really quickly is acne vulgaris. Propionibacterium acnes, we know all about it. There are different types of acne. And essentially the proposed mechanism is to use the frozen sea technology to essentially suppress the activity of sebacites and to kill the Propionibacterium acnes. This is a 15-year-old female who had 4 sessions, 3 weeks apart, and essentially had good resolution of her forehead acne. This is another male, 25 years old. Now the protocols have changed a little bit, and I'll show you the new protocols with my treatments, but essentially these were slightly higher temperature treatments, but you get resolution of the acne. In rosacea, we know essentially you have excessive blood flow to the tissue, and a lot of inflammation is the foundation. There are different types of rosacea. We're not going to go into that. But essentially the way that cryotherapy has been used in rosacea is through the hunting effect. And essentially by creating this cyclical vasodilation and vasoconstriction and immune modulation, you suppress the erythema in the tissue. This has been well established in the dermatology literature. This is a 60-year-old female that we treated. And essentially she has really bad rosacea, okay? And on the Vizia, her rosacea score is at 1. This is 30 days after just one therapy, taking the temperature to 5 degrees centigrade. She went from the first percentile to the 67th percentile with almost complete resolution of her rosacea. So this is included in some of the further clinical studies that we are doing in the United States. Rejuvenation. This is a 30-year-old woman who was looking for improved tone and texture. This is again one treatment, 1 month result. Again on a slightly different setting than the Korean initial data, where we take the temperature slightly lower. Again, we see significant improvement in the Vizia scores as it relates to spots and especially texture. This machine is really, really effective as a rejuvenation technology for improving the texture of the skin. It's also very significant for basically sterilizing the skin. So on the Vizia system, you have the porphyrin counts and it reverses those. Another 30-year-old woman, same issue, and same improvement in texture and spots, and significant, again, reduction in porphyrins. Again, porphyrins. So these are the clinical applications that we believe cryotherapy will be important. Most significantly, we believe acne, rosacea, and then essentially aesthetic treatments for tone and for texture. And again, the design here really highlights the feedback. So whereas cryotherapy can be kind of a dead end where you don't really know the temperature of the skin, so you're going to get a lot of temperature variability. With this system, that's been corrected with the temperature monitoring so that the skin is held at a uniform temperature, and then using the glycerin gel, you're getting even a more guarantee of a uniform spread of the cryotherapy. Thank you so much. Any questions I can address? Okay, thank you very much.